Okay.
It's happening.
All right. It's happening.
It is.
It's happening.
Yes.
In the new studio. That's
It's
like
coming
for real.
together.
Because last time I feel like it was a little rough. We had some side issues.
We did.
Who thought we had sides?
Girl, I don't know.
Now we know.
No, I knew I had a side.
Did you?
Yeah, my left.
I thought that was like a thing that just rich celebrity people do. They're like, I have a side. And then I watched our clips and I was like, holy shit.
I have a side.
There definitely are sides.
Yeah.
And I was not on the right one last time. So.
Yeah. Yeah.
It looks better though. There's things.
Yeah.
It looks cute
we're getting
for anybody watching.
We're getting our set together.
Yeah, we're working on this. All right.
Okay, so today we wanted to talk about something that has been all over all your feeds and all over the news. And what we're talking about is the Lindsay Clancy case. If you are unfamiliar, it is the Massachusetts mom of 3 that is on trial currently for...
She was a delivery nurse.
Yes. And she is on trial for the murder of her 3 children. And so currently there is nothing's being contested that she didn't kill them, but what is being contested is kind of the like why. So was she sane? Was she criminally liable?
Right.
Or was she suffering from a mental health defect that made her incapable of being responsible? So that is really what is of being questioned right now. So one of the things we wanted to talk about, why we wanted to do this episode, and we're going to do like a little bit of a series.
We're going to do a whole series on this. By the time our series is over, you will be educated on this, not necessarily the aspects of this case, because that's not really what our expertise is at all, but the mental health questions that are built within this case.
Yeah, that are coming up. And so today what we wanted to talk about is kind of the psychology behind why we are so obsessed with something that on the face of it sounds so horrific and morbid, and we can't look away.
Yeah.
And I think this comes up a lot with true crime too. Is like that is another thing that people are just like, it's insatiable.
And people are engrossed with this case. I mean, I'm sure clients as well have come in. I've had client after client say, are you watching this? You know, are you up to date on what's going on? Are you listening to what's happening? And I think, you know, as a culture, we're very drawn to this case. As females, we are.
Girl, you got a piece of hair. Your mic is right in your... You see it? Your mic is just having a piece of hair. Oh, there it goes. Sorry.
It did a drop.
Yeah, you're good.
Honestly, you could make a wig out of just what falls from me on a daily basis.
You should have seen me cleaning out my vacuum. I was like, girl, be shedding.
Seriously.
We're struggling.
And then in menopause, it just kind of falls out. You know, speaking of hormonal issues that occur.
Women, things. So yeah, we wanted to get into like why we are so obsessed with this, why we can't look away, why we're so drawn to it.
Yes.
So I think some cases, you know, I think also the fact that it's televised, obviously, is another huge
because this
component.
happened 3 years ago. And it has not been talked about much. I had
assume, not heard about it.
I would assume in Massachusetts it has been a much bigger case, but for the layperson, for the rest of us, this has become something that it's almost like we all woke up to the same story, but the story, you know, unfortunately, this situation happened 3 years ago.
Correct. And so I think some cases we follow because they're just absolutely shocking. Some get under your skin. And I think the Lindsay Clancy case is more this because they threaten the way that you understand the world and people.
Right.
And that is what this case is doing, which is why we are so drawn to it.
This can't happen, right? This doesn't happen. This is, you know, especially women and moms, we just have a feeling like this. No, this doesn't happen. There's got to be another reason.
Yeah, and so it's not just a story about a mother who killed her children. It's a story that forces people to question things they really don't have answers to. And so, and some of those questions are like, can somebody love their children and still kill them? Our brain is like, what?
It's an immediate no, right? It's just an immediate no.
Can someone be severely mental ill and still look organized? Again, on the face of it, our brain is like, immediate no. Right? Can a person be both sick and responsible? Again, our brain goes, immediate no. And this case is saying, but what if the answer isn't no?
Right. Another question, too, is, and I've gotten this question 3 times just this week alone, can medications really affect me to the place where I am no longer thinking correctly, I'm no longer thinking rationally, right? We want to say immediately no. right? No, your medications cannot do that to you. There's a reality behind that is not the truth.
And again, I think today unfortunately, this episode is probably not going to answer any of your burning questions about the case itself.
Again,
but
not our expertise.
Yeah, but it's understanding like what is going on in our brain when our brain is being asked or confronted with these questions. And that is what this case is doing. It's confronting everybody with questions that our brain typically says, I can't hold these two things, and that they don't live in the same space. And our brains are kind of like spazzing out,
confused.
for lack of a better term.
Tell me this can't happen or that can't be true.
Yeah. And I think one of the most uncomfortable questions that it's forcing us to ask is like, would we know if someone we loved or we ourselves were that unwell?
Yeah.
Right? Because I think that's another question. Everybody in hindsight, we can be like, I would have known. I would have done this different. As therapists, we can look at, there are aspects of this case from a clinical perspective that we can look at and say, would you know?
Yeah.
Would you know in the moment?
We're listening to the same thing everybody else is listening to.
Correct.
We're listening to the providers get up there getting quizzed about their treatments and what they missed or what they didn't miss. And so, yeah, I mean, you can look at those things, but even we do the same kind of investigative search in our brains is like, would I have missed that? Would I have caught it? Would it have been different? It's very different. It's very difficult.
Yeah. And I think one of the things, at least to me, that was like most striking was, and I don't know what day of the trial it was, so I wish I could, so you could go look it up and watch it. But the day that the ER doctor was on the stand and the psychiatrist, and you listen to their testimonies, and it's not just, I think there's an element of like personality and how they present, but you see what certainty we have medically and what uncertainty we have psychiatrically.
Absolutely.
Like the disparity between the answers they were able to give. They were like, we gave a CT scan, the blood was this, the tox was this, right? And it's like...
Temperature was this. Like there's such concrete things.
And we're like, she answered to this. They're like, did you give her this scale? No, we normally don't do that, right? And so there isn't someone comes in with a head wound, we give them a CT, we do this.
Right.
And so there's so much gray area, and I think that just pointed out the huge disparity between, at least for me.
In the next episode, we're going to talk about postpartum depression, postpartum psychosis. We're going to go through the whole thing so that we can kind of break it down and educate. But one of the things that we're going to talk about in that episode that is a thing for me too, because you mentioned the scales, is basically a survey, right? There's 2 surveys that are given to try to suss out postpartum depression symptoms. It's unreliable. And we've talked about that on this podcast a million times, that, surveys about, how much do you drink? And you're always like, let me give it a lower amount versus the higher amount. Or do you exercise? Sure, I do. Meanwhile, I haven't exercised in 6 months, right? So those scales are just, they're unreliable. And so the part of this obsession is we just want concrete yeses and nos.
Right. Someone can come in and say like, no, I didn't fall down. And it's like, well, I do an x-ray, sir. And like the x-ray says otherwise.
You have a broken bone.
And that was one of the things I think as a clinician that was so frustrating for me, as they just kept hammering the one psychiatrist like,
yes,
yeah, but she reported, what if she lied? We have no way of sussing that out. And he kept saying, the thing that really
this
was the
female psychiatrist, right?
Yes.
The one had only been in practice. She had been licensed, but was only practicing about a year at the time.
No, not that one.
Oh, okay.
The other one.
Oh, okay.
That was at the same hospital.
Okay, got it. Okay.
Yeah. So the defense attorney kept saying this was the more kind of like seasoned clinician.
One, yes.
Struggled, I think, on the stand to communicate things. But one of the things was like he kept saying, and I wish there had been the prosecution, had raised an objection. He kept saying, during your investigation, I just want to make very, very, very clear that as clinicians, we are not investigators. We gather collateral information to the best of our ability, but we are not detectives. So he kept using that language, and she never corrected him, which I think was like such a misstep, because I would have corrected him and say, we don't do investigations. We do collateral contact to build a picture as best we can of this client, because we don't have CT scans and we don't have blood work that can tell us like if you have depression or if you don't.
We have to go by the word of whatever we're being told.
But it's not an investigation. There is no certainty there. And I wish that narrative, because he just, as soon as the word, she didn't correct it, he just kept using it, and then it just became canon. It was just like, this is
And to support what you're saying even more, just to give it in a different context, if someone comes into our office and says, I think my spouse is cheating on me, we don't just go, nope, where's your proof? I can't buy into that idea unless you show me concrete proof that your spouse is cheating. We just meet them where they're at, right? So we're like, okay, that must be a terrible feeling. Tell me why you think that. Tell me why you're feeling that way. Tell me about your relationship. We are not trying to prove evidentially what you just said.
Correct. Because we're not detectives.
Yeah, we're just trying to gather information about how you feel. That's where our job lies.
We are assessing diagnostic criteria. We are not detectives, though. So I think the other thing, when we talked about this, uncertainty we hate generally, but I think it is brutal when the stakes are this high and they couldn't be higher.
Yeah.
What does our obsession with it say about how badly we need something to make sense and we need stuff to make sense? And that's, I think that also is a function of like true crime in general, is our brain wanting to like close the gap, the cognitive dissonance, because it kind of like hurts our brain.
Make sense.
Yeah, make it make sense. Like make the math
make sense.
Math. So number one, and these are just, we put together about like 5 to 6 reasons why we're so obsessed.
Right.
I can't even talk today.
It's okay.
But this is obviously, there are plenty more. These are just the ones that stuck out to us. So we desperately want there to be a clean line between good and bad and sick and evil. I think particularly the sick and evil is, if you're sick, I want to be able to see it, know it. I don't question it at all. And I mean, not for nothing, but the woman is paralyzed from the waist down in a wheelchair. So there is some observable things, right, that speak to her level of mental and physical health.
Yeah.
Right?
Yeah.
And so our brain really likes categories. Right? In this case, refuses to cooperate with that.
Yes.
Just when you think, right, our brain starts searching for stuff, cognitive dissonance, because it's painful. Our brain's like, let's just look at evidence that aligns with what I believe to be true. If she's bad, I'm going to ignore the stuff that might contradict that.
Right. Don't
only
tell me that she was suffering. I need to just see her as a villain.
Correct.
Then this makes sense in my head. This was a horrible thing. Then this was a terrible person who did a horrible thing.
Right.
And then that would make sense and I can be at some sort of peace with that. But
Correct.
please don't tell me that this person was suffering, and the suffering equaled a horrible thing.
Right.
Because you don't have a clean box to put that in that lets us rest.
Right. And so it's like, you can be profoundly mentally, it's like she's profoundly mentally ill and killed her kids. And we are like, you're either profoundly mentally ill or you did this or it's this, right? And we want one to kind of cancel out the other.
Right.
And then we get to a place where we go, well, if we're saying she's mentally ill and sick, are we saying that's an excuse? Or if we say she's evil and terrible, are we denying the reality of her mental illness? We want a villain or we want an absolute tragedy.
Yes. And I think what's harder for people to listen to, and again, we are probably not as up to date as many other people are just because of the time we can do. But I think one of the things that's hard is to listen to all the people in her life talk about how wonderful and attentive and caring a mother and a nurse and a friend that she seemed to be to all the people. So to hear those facts, again, challenges, nope, you're either evil or you're wonderful, but you can't be both. That's why that's what Kate is trying to say, why we're so invested in this, why people are live streaming this every single day.
Yeah.
And it is because it's a contradiction constantly. This is a horrific, murder trial. How am I feeling so sorry and sad for the person
that committed it? And it's like, again, it's like the villain or tragedy. And like, what do we do when one person occupies both?
Yeah.
So number 2, we think we would know what severe mental illness looks like. I think that's the other question is, how did people not know?
How did you not? That's
how
the
did
question.
they not see it? How did they miss it? They're asking the doctors that. They're asking family that.
Oh, yeah. The parents, the grandparents. I mean, everybody is being questioned in terms of
Yep.
what did you do? How did you miss this? How did you not see it? And what's interesting is that they're all expressing, we saw it. She was expressing
She was desperate. She was asking for help.
We were there.
Repeatedly.
We saw it. We were encouraging her to get help. We were taking her to get help. And again, it's what's so upsetting to us. Is why we can't let it go, because everybody was doing things. Everybody was active in the plan to get treatment and to get help. So how could it fail?
Yeah, I think one of my biggest issues, I mean, I think it's, and whatever, they did their due diligence, but the prosecution, one of my sticking points that drives me nuts from a clinical standpoint is that they keep pointing to her functioning ordinary behavior. And I'm like, ugh. Like, yeah, I have major depressive disorder and I still function. I'm really high functioning. That does not take away at all my mental health diagnosis or the symptoms of my mental health diagnosis. Don't really give a shit that I'm a therapist and that I should be able to, doesn't really care.
Doesn't absolve it from anything.
No, it doesn't.
And that's what's so dangerous. And we will talk about that in our next episode about postpartum depression and PPP is that's the danger part is that these moms are still changing diapers at 2 a.m., breastfeeding all night long, getting their toddler off to daycare, doing all the things. That does not eradicate the depression.
Correct.
They're doing the job. They are doing all the things. And we'll talk next episode how in most cases, the children are being cared for quite well when the mom is suffering. But that women are suffering and men also who suffer from depression, just because you're functioning well does not mean you're fine.
Correct. And part of that is biological in nature, right?
Yeah.
Is like caring for our young is wired into who we are, right?
Yes.
It's like very primitive. But yeah, so the prosecution is looking at ordinary behavior like, oh, she's posting on, social media and caring for her kids and making plans and Googling things or texting people. And that should be evidence that she's okay. And we really want severe mental illness to be really obvious.
Right.
That we would recognize it immediately.
Should be like a red flag,
I can
neon
see
sign.
it. I can see it. And the possibility that there can be pockets of functioning while being deeply unwell takes away one of our favorite forms of psychological security, which is I would have known. We love saying that. It makes us feel so warm at night. We say that all the time with true crime. Like when there's victim blaming, well, I would have known.
Yeah.
I wouldn't have gone alone, or I wouldn't have worn that, or I would have done this, or I. That is our favorite. It's like a blanket. We just our brain just wraps up in it and is like,
loves
I
it.
would have done better.
But we excuse it when somebody is in a manic episode and they're highly productive or they just made the greatest music anybody's ever heard. The album's amazing.
And we're like, it's beautiful.
Right? They wrote a musical within 24 hours because they were in a manic episode. And then we're like, well, look what came from this. This was amazing. And those we're okay with, but don't do anything.
We're okay with it when it's productive.
Exactly. Or we
if
get
it's
something
not,
positive
we're not
from
interested.
it.
We're like, no, thank you. We're not interested in it.
Yeah.
Okay, number 3. Ooh, this one rough. Mothers are supposed to be the safest person in the room.
Yeah, so let me tell you straight up. I have always told my kids, they're much older now, but when they were younger, I said, if anything ever happens and I'm not there and your father's not there, you find a mom with kids. She will help you. You run to a woman who has children around her and she will help you. If scared and you need direction, you find a mom with kids, right? That is what I have told my kids always, because in my mind, that is the safest person if I can't be there and their dad can't be there is find another mom. I think she will help you. So yeah, we have this image that moms are protectors. They will care. Not only will they care for their kids, but they won't let another kid be harmed. It's like a thing for us. We just, no child will be harmed on our watch.
It's a code.
So watching this case affects us, especially if you're a mom. It just affects you to your core.
Yes, and to that point, it's like some crimes horrify us and some violate something that's more primal, which is what you're talking about. And motherhood has like an almost sacred cultural script, to your point, right? Like no one will be harmed on my watch. Like we protect, we sacrifice.
And don't
safety.
you feel that like in some way you're like, if I'm here, every kid is getting out of here with me. Like there's no child that's going to get harmed if I'm right.
Like I think, and this is a little bit sidebar, but I think this is one of the things that can be so confusing for other people. Like if you are a person that has any kind of complicated relationship with your mother figure in your life, like I do, and when I explain that to people, the response
I've seen
very
you get that
often
response.
is, but that's your mom.
Yes, I've seen you get that response.
But that's your mom. Like I have experienced that mothers are not always the safest person in the room. That is the experience I've had. And other people, because of this, and it's not their fault, but because there's this sacred cultural script. And so it challenges our understanding when a mother becomes the source of danger.
Absolutely.
And
it knocks us off our access.
I have experienced that of like, my brain is like, this does not make any sense to me. How can you be causing me so much like emotional pain? And you're also supposed to be the source of safety and comfort and love
and nurturing.
And it's hard when you're the one experiencing it.
It's up the whole schema. It messes up the whole script.
Yes. And so we try to make sense of it. All right, number 4, asking, could this happen to me?
And I feel that to my soul for every woman who thinks about having children, for every woman who is pregnant, for every mom who's post-delivery at this point, with every new mom who is struggling with a newborn or has others at home, any woman at all who has been through anything like this or just thinks about this in the future, you are in that place where you go, okay, this woman was a nurse. She always wanted to have children. It was all she ever wanted. She boasted about the children. She showed pictures all the time. How can this happen? And could it happen to me?
Yeah, and I think not just mothers, I think women in general, because let's say you're not a mom, you had no plans of having a kid, you might look at this and be like, see, this is why I'm not having children. So I think in general, and I think this question, could this happen to me? Another phenomenon that has happened enough times that it is in fact a phenomenon which is horrifying is when parents have left their children in the car and they have died. Has happened so many times, but I think this question comes up all the time because as soon as we hear about that, we go, I would never do that.
Oh,
I would never
one of
do
my
that.
biggest fears when we took the kids to daycare, because the mornings would be so crazy, 3 kids, some on buses, some whatever. Everybody, somebody was always going to daycare for. I literally would text my husband on his days and be like, or I would call the daycare. Everyone's there, right? Everyone's out of a car because you hear it happens, which is much like this case. You hear just something that just
so many times.
And so it happens, and then once you know it, you don't think, oh, that's so random, it would never be me. You think, oh my God, what would I do? How do I prevent this from happening?
Yes.
And so there's so many women right now saying, how do I make sure this is never me? And that's the scariest thing, because there's no script. And we'll talk about this in the next episode that will guarantee that a postpartum psychosis is so different than postpartum depression. But postpartum depression is a very prevalent thing that women go through, and we have to talk about it more.
And I think we're talking about like men and women saying, could this happen to me? And I will say, like, the cases with leaving a child in cars happen to both men and women. And some parents get prosecuted and some don't. I mean, it's wild. But I think also asking, could this happen to me? There's also men whose wives just had children or they have young children and they're sitting there thinking, could this happen to her?
Yes.
Like, oh my gosh.
Absolutely. Other than asking you how you feel.
Right.
How will I know?
Right. And that's the thing, and we'll get into that, is like everyone's like, how will I know? Are you being truthful? You're being, and that's the thing that drove me nuts about the defense, is they're like, you should have done more investigation. As the person, you don't always know. So you are being honest to the limits that you have.
Yes.
To the best of your ability. But sometimes you don't even know. And that's the other thing, is like, could this happen to me? We all have heard language in this trial that sounds very familiar, right? Like anxiety, insomnia, depression, intrusive thoughts.
I don't know how I
fear.
feel. I don't feel like myself. These medicines, I think, are making me worse. I mean, there are so many phrases that so many people can identify with.
Or like, wait, I've thought that. I've said that.
I've said that. I've heard myself say that. Yes.
So we recognize it in ourselves. We recognize it in front. Oh, my sister-in-law has had insomnia, or oh, so-and-so, right? And part of it is like, well, where's the line? How do we know it's just insomnia? And how do we know it might be this? And that's what we're going to talk about in our other episode. When do these things become something else? Would I see it? Would other people see it? How do I know I'm not her? Number 5, we want psychiatric diagnoses to answer moral questions it was never supposed to. And we want that in true crime too. We're like, you're everywhere. Psychiatry, again, going back to, it is not investigative. Psychiatry can help us understand symptoms and someone's mental state. Morality is an entirely different conversation. And that's what is the struggle here, is we're trying to use psychiatry and the law to answer that question. And neither one of them, quite frankly, are really designed.
Like, and you'll see a lot of arguments about morality right now. Some people who vehemently believe one thing, some people who vehemently believe another. And one of the episodes we were going to do a couple weeks ago, we have had just the schedules. But one is, and we'll do it later, but after this series, is about perception and how our perception affects our emotions. And that's a lot to do with morality, because we all find morality and judgment to be totally different than other people. So you'll find a lot of people wifting back and forth between this, because where their line in the sand is of judgment is different.
Yeah, and understanding something is not the same thing as condoning it.
Which is so important.
Yes. Condemnation, so condemning something, does not require us to stop trying to understand it. So those two things are important. And last but not least, Number 6. This case is forcing us to sit with uncertainty, and we hate it. That's probably the number one thing that clients complain about, like that are struggling with, that all of our super unhelpful behaviors that we do are usually because we want to we want to feel some relief from uncertainty.
Make it make sense. We say it all the time. It boils down to people just feeling like, I want you to make this make sense.
Right. And so we are here, we're on week whatever it is, day whatever it is. I know prosecution just wrapped, the defense is putting on their case, and we are still looking for that one piece of evidence that explains it all. The one expert, the one journal entry,
Make
the
us
one
feel
medication,
better about this whole horrific situation.
The one statement. We want it. And so that we can just say, oh, now it makes sense. And the reality is this. The reality is we are asked to do something much harder. We are asked to accept that children dying at the hands of their mother will never make sense. There is no, and I am of the mind, that's why I hate the phrase everything happens for a reason, because I would rather live in uncertainty. But that's how bad we can't stand uncertainty, is we're like, bad shit happened, there's probably a reason for it. Like, and there are plenty of people that find a lot of solace in that. For me, I don't, because I don't want to live in a world where there is some way that makes sense.
Right.
I really don't. Because that children dying at the hands of their mother will never make sense to me. Because we are trying to convert something that's unbearable into something understandable.
Right.
And if we can understand it, we can recognize it. If we can recognize it, we can prevent it. And then maybe if we can prevent it, the world would feel safe. So we're not drawn to this because it's horrific, and I just want to clarify, it is horrific.
Yes.
We're drawn. It destabilizes categories we rely on to make ourselves feel safe. There are no clean lines in this. And underneath all of it is a much more uncomfortable question. What do we do with a person when the worst thing they have ever done and the sickest they have ever been occur at exactly the same time? Then what? We don't know.
We will talk more next episode about more of postpartum depression, postpartum psychosis. And so we'll finish up this series, but we're watching it with you.
We got you. We taking care of you and your mentals during this stressful time.
You got it.
Yes.
All right. Check us out on nearlynormalpodcast.com, or you can listen to us on Spotify, Apple, Podbeam. You can watch us do this in all its glory on YouTube. So reach out to us. Tell us what you want to hear, what you don't want to hear. We would love to hear from you, as long as it's always kind.
Until next time, stay nearly normal.